Data from Australian National Asthma Council shows over 2.5 million Australians have asthma, about 1 in 10 adults and about 1 in 9 or 10 children. Asthma is a chronic and lifelong disease that we need to understand and give appropriate management. In this video, we will discuss the signs and symptoms, homeostasis disturbance, and involved organs and tissues. Before we start to dig into asthma, let's have a quick look at the normal airway autonomy and gas exchange process.
Air goes in through your nose and mouth, then down to the trachea, then branch into two smaller airways, taking the air into each lung, then continue into smaller airways, which is called bronchiole. Take the air deep into the alveoli, where gas exchange happens here.
So in order to have a better understanding of this disease, let me provide a case of acute asthma attended patient from emergency room to discuss. So we got patient Ryan. You can have a look his symptoms and signs and examination from this PPT. And asthma is a disease with many different symptoms and occurs in many different ways and combinations. Some people with asthma only has symptoms periodically and they are generally mild, while others have more often and severe symptoms. Some will even have symptoms every day and life-threatening. The most common asthma symptoms include coughing, especially at night, shortness of breath, wheezing. These three also showed on our patient Ryan, and common cold, chest tightness, pain, and pressure. Then let's have a deep dig into the asthma. What processes are involved in this homeostasis disturbance? In asthma, complex cascade of events occurs, which begins with exposure to a trigger.
When an individual exposure to a trigger, it can lead to inflammatory response. There are 5 kinds of responses. The first one is mucus hypersecretion, and the second one is airway hyperresponsiveness. Airway hyperresponsiveness can lead to bronchoconstriction. This one can result in airway limitation, like hypoxia. Hypoxia can lead sympathetic nervous system outflow increases. And this increasing can result in respiratory rate increases, like this patient, his respiratory rate is 26 times 1 minute. That outflow increases can also lead to heart rate increase. And the X-ray show hyper-aerated airway is also related to increasing respiratory rate. And hypoxia, except that hypoxia can result in cough, tight chest, and wheeze. Chest wall sink inward. So the other 3 responses of inflammatory is increased capillary permeability and vascular congestion and vasodilation. Those 3 kinds of responses can lead to airway edema, and that can lead to dyspnea, but that's not happened yet. From the scenario we talked about, the organs and tissues are involved or affected by the homeostatic disturbance in that patient include, firstly, airway. Airway that be affected has bronchs and bronchiole. And except that, the whole lung are also be affected. The chest walls movement is affected as well. And with the exception of that, capillary involved in that process. From microcosmic perspective, mucosa is affected as well.